Hello, everyone, and welcome back to the show. I'm your host, Levi with Mailbox Money here in Sioux Falls. And today's guest is Dr. Dennis Miller. He's an oral and help me out with that pronouncing it. Maxi,
Maxillofacial.
there we go.
Yeah,
Listen
yeah.
to the man who knows. And Of Siouxland Oral and Maxillofacial Surgery. He's the co-owner there. He's been practicing since the late 90s, serves on hospital trauma teams, teaches in the region, and stays deeply involved in both medical and the local community. Dennis Miller, thanks for joining us today.
Yeah, thanks for having us on Grit and Growth. Just like to kind of go through our story and see, what do you think your listeners are going to be interested in?
Yeah, absolutely. Well, first of all, thank you for the assist on pronouncing. That's not my strong suit. Let's start with before breaking down kind of what you guys are doing and what maxillofacial surgery and oral surgery actually is and what you guys are doing. Would you mind giving some of your personal background to let people know you a little bit better?
Sure. Kind of a checkered past. I'm actually from Canada, eh?
Hey,
Yeah. I grew up in Northern Ontario, and well, actually, as my dad said, he's a pediatrician, and partway through one residency and another, we had to move to the Northwest Territories, kind of the North Pole. So, as he said it, we needed the money, so that's why we
yeah.
went in the middle of nowhere. So South Dakota, I think, gets a bad rap sometimes for being cold, and we've kind of snapped our warm streak here. So welcome to winter again. But guys, this is like Florida to me.
Yeah, no
Yeah, I
kidding.
moved south to South Dakota, but that was a long time ago. I did my college in Ontario, Southern Ontario, at Western University, and you get into oral surgery through the dental route, not through the medical route. And so I did the dental school in Detroit, and then I did what they call a transitional year in Chicago. I was
Yeah.
27, probably one of the best years of my life because my car insurance went down. That was good, but it was also
That's the exciting stuff, huh?
that was very exciting. And I remember going home to visit my parents that year, footloose and fancy free, and a deer hopped out of the woods on a primary road and landed right on my car.
Oh
Took out
boy.
the windshield, the headlights, the front hood, the radiator, and I had about an hour left to go. I remember going to the border, and the customs official looked at me and said, "Son, go home."
That's
So
funny.
leaves an impact. But then I did a teaching year in Ann Arbor, Michigan, and then I did my oral surgery in Philadelphia, Temple University.
Very
So
cool.
yeah,
All over
so
the place then.
all over the place, and the training in all those places were in the inner city. So you get to see the worst of the worst. And like my instructors told me, we called them attendings. They said, what you see here, you won't see anywhere else. So when you go out into the real world and private practice, there isn't anything that's going to phase you because you've already seen it. And I've been out since '98, and they were right. We see some crazy stuff over here at both hospital systems and in the office, and I can look back at the training and go, yeah, that's pretty close to what we saw once before, and this is how we managed it. And the materials and the techniques are a little bit more modern nowadays, but I gotta tell you, sometimes that old school stuff, boy, it comes back. And
It's still
if you didn't learn it, all you learn is the new stuff, and you're kind of stuck. Sometimes the old guys know what they're doing.
you should take note and actually listen, huh?
Yeah.
That's a great piece of advice. I gotta ask Dennis, being from Canada and now living down here, obviously the Olympics are pretty fresh. Where'd you fall on that side of things with the hockey between Canada and America?
Oh, well, following the hockey, I'm
USA.
not like an extreme, fan or anything, but I like my hockey. And what I see over the years is mostly players in the NHL. They're mostly Canadian anyway. So was Canada playing Canada. It didn't matter which
There
team
you
won.
go.
I was cheering for them both. But
You
I
you
am I'm an American citizen. I've been an American now for a long time. So America is my home. I'm an American. So yeah, go Team USA, man.
I like it. Yeah, it was fun and exciting. Like you said, no matter what, you come out on top.
Pretty
It
much.
was very good games. All right. Sorry to get you off topic here. How about Dennis, for the everyday person and like myself who can't even pronounce the word right? Explain to us what oral surgery and maxillofacial surgeon does.
Sure. We for that exact reason we kind of contracted to oral surgery.
Yep.
So, well, as you can guess from the name, there's kind of two parts to it. There's the office part and the dental part where we pull a lot of teeth. You know, people that have bad teeth or that teeth are in the wrong position, wisdom teeth. That's a lot of what we do. We do a lot of biopsies for simple neoplasms and cysts, and if we find out they're cancers, then we usually refer them out to our friends from ear, nose, and throat because that's where they're trained for the resections and things like that. Um, and then there's the maxillofacial part. So we deal with a lot of the facial traumas that people get. So we fix the broken bones around eyeballs and noses and upper jaws and lower jaws and jaw joints and all of that. But we also take care of people that either were born developmentally or developed as they grew as teenagers, upper and lower jaws that didn't quite grow into the right spot. Maybe they're too far forward or too far back, and we're the guys that put them back where they belong.
Very
Um,
cool.
yep. There's also a couple of other surgeries that, nobody really does a whole lot on, but they're part of linked to trauma. And in that facial surgery, we call that, if you had trouble with maxillofacial, then orthognathic is going to be a tough one too, because it's a
Yes.
silent G. Um, so what you do for that one for sleep apnea, for instance, is you go through all the other things, a dental repositioning appliance. You get told, hey, lose 10 pounds or 10% of your body weight, whatever's more. Now the ENTs have Inspire. You can pull the chin forward, you can pull the tongue forward. But the crazy surgeries, you actually pull the upper jaw and the lower jaw forward about a quarter inch, half an inch, and that opens up the whole airway back here.
Oh, wow. I
Yeah,
guess I'd never even really thought of them being related to, yeah, being able to breathe better, moving that all forward. The way you broke it down makes sense, though.
and it's a progression. You start off with some of the things that are relatively easy to do and are non-invasive. And the rule of thumb for a lot of stuff is it reversible, right? I mean, in a lot of things in surgery, you kind of have a fork in the road, and if you go one way, you're kind of stuck, and if you go the other way, you have to go this way. And so, a large part of what we do, and we see patients is we try and tell them they're at the fork in the road, and if you choose this and you want to come back, well, this is what it's going to take, you know.
Okay.
A good example of that would be, let's say, dental implants. A lot of what we do is the placement of dental implants to replace missing teeth. So as the surgical arm of dentistry, we do the surgery, and then our dental friends, they do the dentistry because they're really good with crowns and bridges and fillings and dentures and all of that stuff. And we're really good at the surgery. So it's always a combined team approach for all of that kind of stuff.
That makes sense.
Um, and so when we're looking, let's say, for dental implants, a lot of people like to get it's cosmetic, so they want to fill in space. But they also maybe they have crooked teeth. And now they
Hmm.
go down the road, well, I want to get braces or Invisalign. And so we have to tell patients a lot of times, get your teeth realigned with braces or Invisalign first, because dental implants don't move. Once you put them in the bone, they stay there. And so if you put them into an empty space, thinking you're going to have your dental friends put crowns on them, well, once they move all the teeth around, now they're kind of in the wrong spot,
That makes sense.
you know?
Yep.
And if they're just a
Putting
little tiny,
the cart
yeah,
before the horse, so to speak, right?
right. So that's kind of a good example of, okay, you're at a fork of road. What choices do we have? And why should we make certain choices this way and certain choices that way?
Very good.
Hmm.
I'd like to hear a little bit about the history of Siouxland oral surgery, both you personally getting there and then the company itself, if you will.
Sure. So the company was formed in about 1984 by Al Ackerson. And there were three or four oral surgeons in Sioux Falls at the time. And the population was, about 70 odd thousand, something like
A
that, long time
little
ago.
bit different today.
Little different. And one of them wanted to retire. One of them had to leave for medical reasons. And I think one one got divorced or something like that. So Al and the other partners at the time just bought them all out and consolidated everything into Siouxland Oral Surgery. And we had an office down by it was a 49th and Kiwanis. It's right down there by um what's it called? The Skyway. It's the old Sioux Falls Airport. I think it's called Skyway. And there's a
Okay.
historical
Yeah.
marker there. And it was a dirt field and all that kind of stuff. And so they started that. And then in around 2000, they had this place built that we're at right now at basically 69th in Minnesota.
Yep.
And I came in at around 99, at the end of 99. November 26th, 1999, in the middle of a snowstorm.
Oh boy. I was
Yeah,
gonna say, sounds like a memorable day.
yeah. And then I went right to work at on the 29th. So they put me right to work and do that. But interesting story, going back to my Canadian roots. I came out here for an interview a couple of months ahead of time. And I met the guys, I met the practice. I thought it was great. And I drove out instead of flying out because I was in Philadelphia at the time and I wanted to get a lay of the land. And my family had driven around a lot. So we'd driven through the Dakotas when I was a kid. I even have a picture of when I was 5 years old. And those the dinosaur park in Rapid City?
Yeah, absolutely.
Yeah, well, they have a picture of me, with the dinosaurs. So of course I have to recreate that. So I've got that in my back pocket. And I did it with my kids now. I got a 10 and 12-year-old. I think they were 6 and 8 at the time. So I've got them, with the dinosaurs. A little history
That's
there.
very fun.
So I drove it in. And I was down there at the 49th and Kiwanis Place, and I was going back to the hotel. And just recently, when they were doing the reconstructions and stuff, they tore apart what's it called, Sioux Sports, which was on Western
Yeah.
and 49th, right there. And I remember it was in the evening, it was after supper, and I saw the sign. It was this big metal sign, went up about 2 stories, and it had SOO, the short form for Sioux, and it was in
Hmm.
these kind of faded, kind of pinkish neon lights, right? Kind of like little stripes. And I remember looking at that and I went, I'm home. And because we had a Sioux Sports back where I grew up in Sault Ste. Marie, but that's the French spelling, but it was darned if it wasn't the same sign. So I called up my mom and I said, Mom, I'm home. I found my place. And she said, Great, when are you coming? I've got supper ready. I said, No, Mom, I'm in Sioux Falls on my interview. Mom was disappointed.
Uh,
Um,
I, you probably could have worded that a little bit better to where it's set up, but that's all right.
so yeah, probably, but you can tell that they've been good memories since I started here. It's been a good practice. The older partners have retired. We now have Lou George came in 2007, and we've been working together since then. And then Jason Leet has been here since 2000, 2001. And so it's the Three Musketeers.
Yeah,
And
very
mhm,
nice.
yeah, and so during that time period before, well, just when Lou George came and we decided to make the jump instead of being just centered in Sioux Falls, we also started satellite offices in Mitchell and in Yankton and in Brookings.
Very
Um,
good.
and we're looking to expand also out into Worthington too. So we wanted to bring the specialized care that we offer, to the people in the rural communities. It just makes a lot more sense for 6 of us to pile up in the truck and go to one of our offices rather than dragging, 10, 12 families, from all these
Into
other
Sioux
places.
Falls. Yep.
Yeah, yeah. And even though prices have kind of come down now, but a couple of years ago, prices were quite high. And every time somebody came down to our Sioux Falls office, and for whatever reason, maybe they had friends or family here or couldn't make the schedule work, whatever. I mean, that was like $40 in gas every way.
Hmm.
And when you think someone has to come for a consult, because a lot of times people have to come for a consult first, and then they go back home, and then they come for the surgery, and then they go back home, and now they have a recheck, and then they go back home, and maybe have the problem. I mean, you get the idea, right? So
Yeah.
if we can be, 2 days a week in Mitchell and Yankton and Brookings, that makes care a lot better. I think for a lot of people, it's a little bit
A lot more accessible for sure.
more accessible, and it's just easier for them to get the care that they need. So that's kind of been when you ask, bring us along of how Siouxland has changed over the years, I think that would be the biggest change uh, in our
Getting a new
practice is
role.
being able to go out and help people out in the smaller communities, make it easier for
Sure.
them.
Amazing. I think that's a very honorable mission to have, and sounds like you guys are doing a very fantastic job of actually accomplishing that. Already being in so many different communities. Um, Speaking of community, I kind of mentioned at the beginning that you're involved in a lot of charitable organizations in the region. Why has community involvement been important to you outside of the operating room?
Well, it's always fun to give back. I mean, if you're a probably using the rail probably have to help me with the right words, but if you're a civilized person and you want to help your fellow man, you help in the community, right? You just do things that are right and within your skill set. So we've got a pretty specialized skill set. And so one of the things that I've been passionate about and my wife's been passionate about for a long time is taking care of different of animals. And when I was still flying, I used to fly small Cessna planes, and we belonged to a charitable organization called Pilots and Paws. And what
Hmm.
they do is they ferry typically dogs, but also cats and reptiles and all kinds of crazy stuff long distances across the United States. And so if you have an animal that or a pet that's going to find their forever home rather than being euthanized, sometimes they've got to travel hundreds of miles. And there's a lot of people in that network. But, somebody will, let's say, be in Mitchell and they'll say, look, I'll pick up a doggy in Sioux Falls and I'll drive them to Chamberlain or Pierre, but then someone else is going to have to take it over.
Take it. Yeah.
And those kinds of transfers are kind of tough on the doggies especially. There's a lot of actually long distance truckers that do it too, which is helpful.
Really?
But the pilots need an excuse for flying. Sometimes they'll go to some crazy little hamburger joint at an airport 300 miles away just so they can fly it there and say, "Hey, I've been to this hamburger joint." But this way you get the help an animal. And so we started doing that. My wife's dad came with me on a couple of them, and we took these what's it called, Wernerheimer dogs. There was
Uh-huh.
a bunch of them that were taken away from a breeder and were going to get euthanized, but they found a home, but they needed us to transport six of these doggies. So we took the back
Wow.
seats out of the Cessna and put them in and gave them little collars and harnesses so they wouldn't jump around all over the place and flew them to Springfield, Ohio. And the doggies got scared and the doggies went to the bathroom. And I don't know how they got their poo from the back of the plane onto the front of my 5-point strap, but somehow it took 3 complete washdowns of that plane and stripping it out to get it all out.
That must have been a very interesting
But it was
landing
worth it.
and talking to what I'm sure they're like, what in the world happened here?
Yeah, what happened there? The other interesting time was we got a Great Dane puppy. This is how it was sold. This was how the ride was sold to us. It's a little Great Dane puppy, and Great
A
Danes are
little
big,
Great Dane puppy.
but
Yeah.
you're thinking a puppy's a puppy, right? Oh no, we picked this little guy up in Brookings, and we looked down, and my wife goes, "Is that a cow?" And we got in there, and yeah, it was 6 months old, but it was about as big as any Great Dane would ever be.
Yeah.
Now I'm thinking to myself, how are we going to get this thing into the little Cessna plane? Well, luckily he thought it was a kennel.
Oh,
He just jumped in, had a nice day. We take off, and of course, the doggy's got separation anxiety. He's trying to push its head's about this big. It's as big as your computer screen. So
yeah.
finally, my wife had to go in the back and put his head on there, basically laid 100-pound dog on a 100-pound lady. So, but then he stuck with her when we were in Omaha waiting for the next transfer. That dog wouldn't leave her side. They were bonded.
That's amazing.
And so that's kind of
Um,
a nice segue into other community things. So we got involved with the zoo of all things. And occasionally the zoo needs a little bit of help, extracting teeth, root canal, stuff like that on their different animals. So
yeah,
uh,
what's that all like?
it it's pretty cool. We can look it up. It's been in the Argus Leader a few times that we helped them out. The vet we we function under the direction of the vet as a technician. And so
Hmm.
they kind of tell us, what to do, and we kind of do that, and we bring some equipment to help out some of the animals there. So it's about every 2 years or so they need a little hand with something, and we're glad to help out.
What's the biggest difference? Is it a little nerving? I don't know exactly what kind of animals you've had to perform on, but say a tiger, have you had to remove a tooth or something there?
We've done that. They have a really nice facility for their exams and their procedures, and it's a big glass wall, and occasionally they'll open it up for the public to come and see what they're doing to turtles and birds and whatever else they've got in there, if they feel it's
Hmm.
appropriate. And yeah, we've done root canals on tigers, taken out a tooth on a tiger. Um, Sometimes the tiger twitches.
That give you a little jump, I imagine.
It is, and you don't understand how big these animals really are, and they have these,
So you're right there.
yeah, and they have these green retinas, and they sleep with their eyes half open, and there's lights, and there's these green glows staying right at you, and you're going, oh man. So, everyone gets these flights of fancies that say, well, if I was ever in the jungle, and got accosted by a tiger, I would beat it with a stick. No, you wouldn't.
Oh, no, no,
No,
yeah.
no, no, you wouldn't. And the other one that would probably surprise you is they have three African painted dogs there, and
Mm.
lovely creatures, but they make pit bulls look like a chihuahua. I mean, these things are all muscle and no nonsense.
Yep.
I mean, if you're an African painted dog and you're going against jaguars and lions and hippopotamuses and stuff, well, you better have some meat behind you.
Ain't that the truth?
Yeah. So when you go to our zoo and you look at the animals, they're, in their enclosures and they're a little far away, and you think, oh, what a nice, specimen, tra la la. Until you see them up front and personal, you don't really understand the sheer size and power of these things. And here's my plug for the zoo. Go see the zoo and go support them, because the people that take care of those animals, they really give their entire life to it. And I can't say enough about how good a job they try and take care of all of these different species that they're trying to keep, so that the public can learn about the different animals that populate our world.
Amazing. Thank you for that plug in there. I'd like to open the door for you to plug for Siouxland Oral. If anyone listening is looking to get either a consultation or some work done, where's the best place that you'd send them so they can learn more?
On our website, it's siouxlandoralsurgery.com. So it's a good resource. Or, if you just have questions, give a call. I mean, a lot of our consults, let's say for implants is like the big thing. We do them for free. And we usually spend between us and we employ a number of hygienists that help us with the education. And spend a half an hour with somebody, kind of going through their pluses and minuses. Because, you see on TV, dental implants, they look like little wood screws, right? And
Mhm.
they come in various sizes. Some actually are temporary. They're like little toothpicks. And then you get the standard single root form implants. But now you can configure them in different ways. So if you add a whole bunch together, like let's say 4, 5, or 6, you can bridge them with a rigid bar to hold them together. And then you can put completely fake teeth on them. That's where you see on the commercials the teeth in a day. But unfortunately, a lot of people that end up in that position end up needing a lot of bone grafting and a lot of secondary procedures to get them going. So, and then they have these implants that actually go into your cheeks. So they come in through the mouth, underneath the cheek, and then they come out right here. And then you
Oh,
put
wow.
those guys right through the sinus, and they anchor. And now you can put those teeth in a day kind of things on that. So that's somebody who doesn't have a lot of bone. And then thirdly, there's another group of people that, don't have bone, don't have soft tissue. There's not a really good way to reconstruct them. And this is where some of our trauma expertise comes in. When we fix people that have gone into some pretty horrific accidents and broken a lot of the bones of the face, we put little titanium, metal plates all over. Well, you can get with the advances in 3D modeling on the computers and in 3D
Hmm.
printing, they can actually forge the metal specific and custom to that person's face. And so if we've got to put dental implants in, we make this big plate that kind of anchors all the way over here where there is bone, good solid bone. Whereas here, a lot of times the people don't have enough bone to place implants. There's no good way to bone graft them. And so we put those plates on and the implants stick through, and now they can have teeth in a day. So there's been a real progression of, how implants have started, and where they are today. That type of implant system actually harkens back way back to the 1920s and 1930s. They used to call that a subperiosteal implant. They had to make a cut in the patient's gum, take an impression of the bone, sew everything up, cast the substructure, open everything up, and just lay it on. But what happened over time is they would get infected and they would have to be taken out and they fibrosed and they cause a lot of trouble. So by the 1980s, that kind of fell out of favor. And
Okay.
they didn't bring it back until, well, pretty well 2018. And now it's the same idea, but now we screw them in with titanium and the titanium ends up bonding to the bone and now they're solid. So it's a very old idea that's been brought forward almost 90 years and now we can use it again.
That's amazing. That you kind of in all other aspects you hear about trends coming back. I never would have thought in implants. You're still looking at the past to get what you're going to be doing here in the future. That's amazing.
Yeah. So, you have, in order to do good things in the future, you have to know your past, right? For people who don't know their history, they're doomed to repeat it. So
That's exactly right.
here's your plugs to your high school students. Know your history, read your books.
Very good. Well, Dennis, I appreciate you taking your time today, walking through and clearing up what it is that you guys do and sharing your story with our listeners. We really appreciate it, sir.
Yes, thank you for having me. And if people have questions, give us a call at siouxlandoralsurgery.com or say look us up on the web or 605-335-10 is the phone number, or give them to you and you can pass them along. Heck, maybe if I did a good job, you'll have me on again.
Of course, you did an amazing job, Dennis. You're very, I wasn't expecting to hear about pilot stories or working on tiger teeth. So amazing time, Dennis. Thanks again. And thanks everyone for listening. We'll see you guys on the next one.